And welcome to X-Ray Review. In this video, we're going to go over the best radiographic indicator of an elbow joint effusion, and that would be visualization of the fat pads or the sale sign. So hang on, we'll go through a bunch of examples. And let's begin with a normal lateral view of the elbow. Radiographically, there's two fat pads that we're concerned about at the distal humerus, the anterior and posterior fat pads. Normally, you can see the anterior fat pad to some degree, but it will lay flat against the distal humerus. The posterior fat pad is typically not visualized on an X-ray unless something is abnormal. And when there is an abnormality, like a fracture, the swelling inside of the joint will cause the fat pads to displace and push outward. And that's in reference to the sale sign, when you can visualize the anterior fat pad as it's elevated and being pushed off, kind of like a sail billowing out into the wind. So the anterior fat pad is a great indicator of a joint effusion, and it's the first place we look on a lateral X-ray. The posterior fat pad you usually don't see, and again, with an effusion it can push out, and I think you'll notice in a lot of these examples that the visualization of the posterior fat pad is very helpful. And let's take a look at this first example of an anterior fat pad sign or sale sign with bowing out of the posterior fat pad, indicative of a joint effusion. And the reason that this is so important is if you see these fat pads being displaced, then you can know a fracture is there before you even see the fracture. In a child, the most common cause of a joint effusion in the elbow is a supracondylar fracture. In an adult, it's a radial head fracture. So again, catching this joint effusion can sometimes be easier than seeing that initial fracture. And if you do see a joint effusion, you can keep scouring until you find that abnormality. And let's take one last look at this effused elbow with visualization of the fat pads and compare it to the normal elbow. And now let's go look at multiple examples of joint effusions. This case is a 36-year-old male who fell backwards off a chair with an outstretched hand. And as we zoom in, the sale sign is visible anteriorly and also a good visualization of the posterior fat pad. So in an adult, we expect to see something like a radial head fracture. And here it is. This is a 42-year-old male with a fall on an outstretched hand injury. And here's a good example of a sale sign and visualization of the posterior fat pad. Here's a lateral elbow of a 66-year-old female with a known history of rheumatoid arthritis. And as we zoom in, personally, I think the anterior fat pad is more difficult to see than the posterior fat pad. And this is not common, but again, the posterior fat pad is very helpful, and don't forget about that. Although fractures and trauma are the most common cause for joint effusion, there are many other conditions that can inflame the joint, and rheumatoid arthritis certainly can do that. And this is a good example of an inflammatory arthropathy causing joint effusion. This is an 8-year-old male with a Fuchs injury. And as we zoom in, you'll notice good examples of anterior and posterior fat pads. And the most common cause for a child, again, will be a supracondylar fracture. Alright, pop quiz. Is there a joint effusion in this patient's elbow? No, there is not. This is a normal elbow. Is there a joint effusion present in this patient's elbow? And yes, there is. This is a good example of visualization of the anterior and posterior fat pads. Alright, so hopefully you enjoyed looking at all those elbows. If you did, please like and subscribe, and any questions or comments, please put them below. Thanks again.